Liam, honored to have you as our final speaker for the event. I know there's always the pressure of everyone looking at the clock and thinking, hey, how's it going? But Liam is a fantastic person, really good friend, and I can't wait to hear what you have to share with us today.
It's so great to see, mental health being at the forefront of, you can all hear me, right? Yeah. At the forefront of what we think about when we come together and think about social issues. I feel very privileged to currently work at the Canadian Mental Health Association, which is, I work at the Vancouver branch, but the CMHA is a national organization, and it's been really cool to see both communities around the nonprofit sector and also the CMHA start to think about mental health, both in terms of how to help people who are already in crisis, and then how to help people who really need the preventative measures. And I wanted to talk a little bit just about the programs and services that we offer, just to give you a sort of a sense, I think, of, really what else is out there besides what you might think of most immediately when you think about mental health services. I think when people think about mental health, they most immediately think about counseling or psychiatry or, psychologists and therapists. But the truth is that mental health and our understanding of what mental health is has really evolved in the past couple of decades. And at the CMHA, we have some pretty cool programs that I think illustrate how we're starting to think differently about mental health and what it means as a society to take wellness into account as a really important priority for us. And it's really cool to see in local provincial elections and in government debates that mental health is all of a sudden one of the issues that people are talking about. And that means a lot, I think, in terms of how far we've come for us to be thinking about wellness as one of the biggest priorities. At the CMHA, wellness is, the number one priority. And some of our programs, just to go through them, include programs that are based on peer-to-peer support. So instead of being only able to access a therapist or a clinician, there are programs where people with lived experience who've gone through the system can connect with other people based on their own experience. So we're widening our understanding of what it means to have clinical experience or useful experience, and how those of us who've struggled can support those in our communities around them. There's also programs at the CMHA that help people who are looking for support with employment, who have concurrent issues with mental health or substance use issues. And so these programs are free and they're accessible. And the key thing is really to remember that you don't need to necessarily identify as having a mental health crisis to be part of a program that can help you take the next step on your recovery journey. And that's one of the things I really appreciate about working at the CMHA is that we think about recovery a little bit differently than I think many people might think of recovery when they think about it, which is some people think that you're either 100% recovered and you're happy and everything's great, or you're not and you're suffering with a real mental illness. But what I've learned to think about mental health and mental recovery as is really a process that we're all in, depending on where you're at in your recovery journey, whether you have or are struggling with substance use challenges, or whether you have anxiety like we all do and like I do right now, speaking in front of you. So we're all somewhere along that journey, and the question for us is, how can we help other people in a way that's meaningful and gives back? And so at the CMHA, just to go through some other services that we have, there are child and youth programs that are available for free. There are volunteer programs. A lot of people who have mental health issues need other skills to be to change careers or to take the next step. And so volunteer opportunities are a great way for people to get the skills that they don't have already. And I know I've only got a couple more seconds, but I think the most important thing to sort of leave you with today is if you can think about mental health a little bit differently. Instead of thinking about, if I have a mental health concern, what does it mean, for me to see a therapist? And, private therapy is really expensive. But as we were hearing from the Muslim Food Bank, there's actually tons of counseling options in Vancouver that are low cost or actually free. And so we need to think a little bit differently about mental health. And I think the CMHA, I hope we're doing an okay job of, helping create programs and community opportunities for people to get involved in a mental health program that is more aligned with a different way of thinking about it. So, thanks.
Thank you so much, Liam. Thank you, Sue. That's the event, my friends, and we're honored to have had all of you here. I'd like to thank all our wonderful panelists for spending their day with us, for sharing their wisdom, as well as our support team from SFU, Kabir, Tarek, everyone who put so much time and energy into this. Our organizational partners, such the MSA here at SFU, the Canadian Mental Health Association, Moose Anger Management, thank you so much for being here. Moving Forward Family Foundation Services, the Muslim Food Bank, Aspire, the BC Muslim Association, the great folks at Kids Play, the VPD, always there when we need them, Project Falah, Metro Vancouver Alliance, MAC, Vancouver Centre, Nisa Homes, the Institute for Muslim Mental Health, South Vancouver Neighbourhood House, and Penny Appeal Canada, as well as all the other wonderful people who have made this such an amazing success. But particularly thank you for listening, for joining, and for being here today. Have a beautiful day, everyone. Take care, enjoy your Saturday, enjoy the sun, and have a positive mental attitude.